All right, folks, let's get started. So, hello and welcome, and thank you for joining us for Session 8 of the Rural Research Collaborative Learning Network, so the RR-CLaN Research Education and Training Calendar Seminar. I'm Dr. Alex Stevens, the Director of Research at Northern New South Wales Local Health District, and I belong to one of the member organisations of the CLaN. So today we're joined by the amazing Professor Steve Kamper, who's a Professor of Allied Health at the University of Sydney and Nepean Blue Mountains Local Health District. And Steve today will guide us on the session on how to develop a research question. To officially get us started, we acknowledge the traditional custodians of the lands and waters where we work and live. We acknowledge the traditional custodians' living culture, their connection to country and their contribution to the life of this region. We pay our respects to the ancestors and elders of the region and to all Aboriginal people past, present and future, and any Aboriginal people who may be joining us today. So welcome. Just a tiny bit of housekeeping. So we've got a large attendance again. We'll probably sneak over 100 or between 120, 130. So we've muted your microphones, but please feel free to ask any questions throughout the seminar using the chat function. We'll try to answer them. If we do get time towards the end or at the end of the seminar, we'll attempt to unmute you guys so we can answer some live questions. We're also recording the session today for viewing at a later date. If you don't want to appear in the recording, just simply turn off your cameras. Now, it's my great pleasure to introduce you to today's presenter, Professor Steve Kamper. So Steve is a Professor of Allied Health at the University of Sydney and Nepean Blue Mountains Local Health District, and also an NHMRC Investigator Fellow. Steve is a physiotherapist by training and is ranked in the top 10 researchers in the world in the fields of musculoskeletal pain, back pain, and physiotherapy. Steve has authored over 200 peer-reviewed publications, including top-ranking journals, and has received greater than $6 million in competitive research funding. Steve's work underpins clinical practice guidelines globally. He's regularly invited to present at academic conferences, clinician education meetings, science outreach events, podcasts, and does online interviews in the mainstream media. Steve conceived and writes the Evidence in Practice series of articles in the Journal of Orthopaedic and Sports Physical Therapy, which is used in training programs for clinicians in more than 10 countries. His role at Nepean Blue Mountains Local Health District involves training and supporting clinicians in the district to embed research into their clinical services, and also works with health service executives to design services supportive of research activity. Now, without further ado, I'll hand over to Steve, who will guide you through today's presentation. So just bear with me. I'll stop sharing, and then hopefully, Steve, you can share. Right.
Bingo. Hopefully that's working for everyone. Great. Thank you.
Yeah, all good. Thanks, Steve.
Thanks, Alex. And thanks you for the invitation, and thank you for everyone for turning up. That's amazing, and makes me super happy to see hundreds of people interested in working out how to do research and better research and good research. So this is maybe a bit weird, but this is the sort of thing that excites me. So thanks for turning up. It's great. All right. I'd quickly like to acknowledge the Indigenous people from the lands that I live and work on. So Nepean Blue Mountains Local Health District is on the western edge of Sydney, for those that don't know it, and that's home to the Darug, Gundungurra and Wiradjuri people. So I thought I'd start off just by giving my perspective, sort of where I'm coming from. I thought that might be helpful. It strikes me I have to write shorter bio sketches because that was a bit long and boring, I think. So my background, as Alex said, I trained as a physio. I had a very brief and very unspectacular career treating patients. I've spent most of my time in clinical research and increasingly interested in evidence-based practice. So how do we make the tools and also the processes of research accessible to the people who need them, in particular clinicians. As Alex mentioned, I also write this series of papers. So these are papers which are very much aimed at clinicians. The idea is that they bite off one piece of the research process and just give a very short explainer, about 1,000 words, page and a half, 2 pages. They're a 15-minute read. The idea is they should help you be able to pick up a paper and read it and interpret it a little bit more clearly. So yeah, if you don't have access to those and would like it, please feel free to email me. I'm always happy to send them round. One thing about researchers is that it makes us super happy and pleased with ourselves if we know that people want to read our work. So if you want to make me happy, send me an email and ask me for my papers. So my job as I have a fairly interesting position where essentially the university and the health district pay half my salary each. The less exciting bit of it is that they want completely different things from me. For the university, I conduct my research line of research in pain, and for the district, as Alex mentioned, my job is supporting and encouraging research amongst clinicians, and particularly allied health, but not exclusively. So that's how I spend my work days. In terms of my perspective or my point of view, and I think this is important because this is really what underpins what I'm going to talk about today, and that's that research, and I have a very broad view of what research is, and hopefully that will come through. But I think it can be employed as a tool to generate information to inform health service decisions, and that's really what underpins the work that I try to do, because I have a belief that this can be something really useful on the ground. What this means is that research needs to be, research can be and can be usefully embedded in the health service, and that's a challenge, I think, in many ways, but one that I'm keen to try and take on. An important part of this research, and this is where things divert a little bit, probably from the bulk of research, published research, which is out there anyway, which essentially is owned by researchers in universities. In this model that I work on, it's the clinicians or the health services who own the projects. They own the questions. They own the problems. The researcher's job is to provide a technical role. So we're really there as technicians to help with formulating the question and with the methods and the interpretation, that sort of stuff. But the project doesn't belong to the researchers. Researchers are just the tool. Now, this is something which I guess maybe divides opinion a little bit, or maybe it doesn't. Maybe just everyone disagrees with me. But I have this view that research and QI are the same thing. The reason I have that view is I think they're just about generating information. And so if that's the point of either research or QI, about generating information, then I think all the stuff that I'm going to talk about today in terms of research is equally applicable, whether you consider what you're doing research or you consider it QI. And as I said, I understand that within the health services, there are different pathways in terms of approvals and so on, but none of that really matters for what I'm going to talk about today. All right. So what I want to do before we get going is get you to do a little bit of an exercise. What I want you to do is get out a piece of paper or your phone or your computer or whatever it is that you record written information on these days. I think about a problem that you have at work, and this mean, by problem I mean something that if it was resolved, it would mean your patients get better care. So it might be a problem, you got a long waiting list, or certain type of patients you don't know how to diagnose, or it might have something to do with referral pathways, or some lack of uncertainty or clarity around how you should treat a certain patient group. Anything, let your mind go. But something which is really relevant to you, something which matters in your day-to-day work. And think about this, what piece of research might help you solve that problem? And so this doesn't have to solve it all in one go. It could be a scoping exercise to understand the problem. It could be designing a solution, testing a solution. Maybe your practice is changing anyway and you want to evaluate it. So think about what's the piece of research, the hypothetical piece of research that might help you solve that problem. And then I want you to write down what your research question is. Nice thing about this exercise is no one will ever know what you've written. Okay, I'm not going to ask you. There's not going to be a test. But what I want you to do is develop an early habit of thinking about what a research question might be. I'm going to give you 30 seconds. All right, that was 40 seconds. Generous today. So we'll get on with it. So what are we going to run through today? I'm going to backtrack a little bit, just provide some of the underpinnings. So what is research? And then we're going to get into the guts of it. So what does a good research question look like? What are the different types of research questions? What's the link between a research question and design of a study? And then hopefully we got some time at the end, assuming I don't bang on for too long. Okay, so what I want to start with along this theme of what is research, I wanted to start with a few myths and facts. And there's a couple of myths that I guess I come across whenever I'm talking both to clinicians and to researchers about research. And one is that it's all about statistics. When I talk to clinicians particularly, they come to me and say, I can't remember what a p-value is. I can't remember how to calculate a confidence interval. I know there's something about logistic regression, but I can't remember how to do it. Research is not all about statistics. Research is all about good questions. All right, the statistics follow, and most of the time they're quite simple. So in my mind, there's value in sort of reframing or refocusing what we're talking about here when we're concerned about research. Research is only worth doing if published, and that's something which has grown out of the way that researchers work and are incentivized. And I think we'll find over the next years this changes quite radically because of other changes that are happening in the landscape. Actually, research is worth doing if it has an impact. What does an impact mean? One framework for thinking about that is it has an impact on knowledge, so we know more after we've done it than we did before. If it has an impact on health, so are people healthier afterwards? If it has an impact on practice, does it change the way that we do things? If it has an impact on cost, does it mean the way they do things costs less than they did before? So actually the publication is just a means for dissemination. And to be honest, it's not a very good one. It's not a very good one for having the sort of impact which matters from research. So the idea that it's only worth doing if published, I think is not right. Finally, research and practice live in separate worlds, and they do usually, but they can be as integrated as we make it. And so that's a decision that the players make. By players, I mean researchers and clinicians. Okay, with respect to research and practice anyway. So as I said, we can choose whether they live in separate worlds or not. So what is research? Sorry. This is one definition of research. A series of steps used to collect and analyze information to increase our understanding of a topic or issue. Pretty simple. The key part here is it's a series of steps. And actually, they're pretty simple steps. They're just about these three things: posing a question, collecting and analyzing data, presenting an answer. And obviously today we're going to be talking about this. So there's more to it than what I'm going to talk about. And hopefully we'll go through a lot of the things through this RR-CLaN series. I want you to have a think, conceptualize, I guess, a research study or a project as a machine. Okay, the machine contains components which are the methodological components, And the only point of the machine is to answer the question in as unbiased a way as possible. And that's the bit about generating useful information. If the study produces unbiased answer to the question, then hopefully the information will be useful if we've got a good question. All right, so this idea of a research study just being this series of steps. All right, so the aim of embedded research. So I've mentioned embedded research once or twice. What do I mean by that? I mean, that's research which is done in the course of day-to-day practice. And I'll make the point again, all the stuff about research questions that I talk about today applies to QI projects also. I don't think you need to agree with my view on them being the same, but what I'm saying applies to both anyway. So what's the aim? The aim of embedded research is to generate information to solve a problem or evaluate a service. All right, so the problem lives in the service, or a new service has been implemented, and we want to evaluate it, or we want to solve that problem. In order to solve that problem, we need some information. Now, obviously, the key part here is useful. What do we mean by useful in this context? Reliable, unbiased, trustworthy. These are all relative terms, all right? We never get any information which is 100% reliable, 100% unbiased, 100% trustworthy, but we want to get them as far as possible. Now, that's not the only aim. There can be other reasons for doing research as well. I won't run through them. But for the purposes of, I guess, what drives me in the work that I do, it's really about this first aim here. So generating useful information to solve a problem or evaluate a service. All right. I talk a lot about questions, and when I was offered the opportunity to give a talk in this series, I really wanted to do one on questions. I am a bit hung up on questions. I like it. I think they're really important. And why? And it's because of this. In my view, if you don't start with a good question, everything you do afterwards is a waste of time. That might sound like hyperbole. I'd argue it isn't. And hopefully by the end of this, at least some of you are at least part of the way along there with me. Why do I think everything you do afterwards is a waste of time? One, because the information you generate, and as I said before, all the study is doing is generating some information. Now, if you don't start with a good question, whatever that information is, it will not meet your needs. It will not serve your purpose. And secondly, it won't serve a purpose for anyone else either. So they won't be able to interpret or use it either. So the reason I'm so hung up on questions is because I see them as absolutely fundamental. They're the sort of the non-negotiable start of a study. All right, so hopefully that tells us something about what I think research is and why I think it's important to have a good question. Now, this is the starting premise. As I said, if you have a bad question, you will have a bad study. You can have a bad study with a good question. You can never have a good study with a bad question. All right, so what does a good question involve? These 4 attributes. It needs to be specific and focused. It needs to be clear. It needs to be answerable. And it needs to be relevant or important. All right, so I'm going to run through those in just a little bit more detail. One of the things that often happens with questions is they're not focused enough, and often within a question that's too broad, there are lots of little questions hiding. That's a problem for the research methods. You will not get a good answer to a very broad or a number of questions with one study. You need to break them down. Sorry, I should clarify that. You can answer several questions with one study, one group of, with one set of data collection, but you have to specify those individual questions because the analysis will be different. All right, so is the meaning of all the words in your question unambiguous? A small tip, some things to avoid in your research questions. Okay, don't have things like understand, don't have things like look for, don't have things like explore. The reason we don't have things like that words such as that, is because they're not sufficiently specific. All right, it doesn't tell the reader, it doesn't tell you designing the study exactly what it is that you need to do in order to answer your question. It needs to be clear. And a nice little test for this is, would a person of moderate intelligence understand what you're trying to do? You should be able to pick out your question and put it in the palm of your hand and show it to someone and have them understand. If it's too complicated, your question is probably not clear. Right? Now, we kind of get used to holding information professionally, I guess. Maybe I'm speaking for myself. It's my impression that that happens. But actually, for a research question, it needs to be really, really clear. And I'd argue that that clarity should extend to being able to explain it pretty simply to someone from outside your field. It needs to be answerable. So can you measure what you need to measure? And that holds two parts. It's, do you have the capacity to collect that information? And are there ways of measuring what it is you need to measure? Okay, so you can't answer a question if you can't measure the outcomes. Right? And this is sometimes called the so what question. So you should be able to say, when I have this information, I will be able to do X. Right? So don't start out unless you have some clear idea what generating the information that the study will generate will enable you to do that you can't do so far. Right? So they're the features of a good question. So what about the functions of a good question? And this is really important, because now we're going to start to link the question to the study itself. So what does it do? It forces the researcher or the person who's doing the study to clarify their thoughts and hypotheses. As I said, science is a very systematic process, and it works to the extent that everything is specific and clear. It establishes the scope of the study, so it tells you what's included and what's not included. It determines the study design, and I'm going to talk a little bit about study design shortly. This is what are the components. So who and how to recruit, the timing and the type of data collection, how are you going to do the analysis, how are you going to present the results, and how are you going to interpret and make conclusions. So when we talk about study design, these are the sort of things that are included. Right? So these are the sorts of things that are set out in a protocol, but all of them are dependent on a research question which has those particular features that I mentioned previously, which leads to this. So you cannot design your project, you cannot decide on all these features without a question of the type that I described before. All right, so there are various types of questions which might be interesting for people who are in clinical practice. And the nice thing is that they all fit into one and only one of these three categories. So we have descriptive questions, predictive questions, and causal questions. So what do we mean by that? Descriptive questions talk about what a landscape looks like. Right, what do I mean? So they might be questions of prevalence. So what proportion of people have a certain condition? They might be diagnostic accuracy questions. So if I apply a diagnostic test to someone, what's the likelihood that they have a condition? They might be qualitative research generally fits into the descriptive category. Okay, what are people's experiences of X, Y, or Z? Predictive questions. So that's about saying we have some information now. Can we determine what will happen in the future? All right, that's pretty clear. And causal questions, and that's, as you might expect, does X cause Y? And that these studies generally fall, or these questions fall into two categories. One is, does a particular feature cause a condition in someone, or does it cause the likelihood of good or bad outcome in a patient group? The second type of causal question is, does a treatment cause an outcome compared to something else? Okay, so there are the types of causal questions. Now, just a little tip. Everyone wants to do causal questions, but they're actually really hard. Most of the time, only question type 1 are feasible. Question type 2 is harder than you think to do well. All right, so in general terms, as we go through the numbers, the higher the number, the harder that study is to do. When I say harder, I mean it's more complicated to design a study which will give you good quality information for a predictive or a causal question than it is for a descriptive question. But in any case, what you should be able to do is, when you look at a question, is put it into one of those three categories. All right, so there are lots of different types of questions which people in practice might be interested in, and these are some of the types. As I said before, all of them can map to one of these three types. Things get a little bit funky here for reasons that I won't go into today, but just to flag that. Now, one of the things that's important here, or one of the points that I like to make, is this idea of the type of question and also the features of the question. That's important whether you're designing a study or whether you're reading a study. So the implications of that, if you're reading a study, is that if you cannot clearly define the specific question that a particular study is about, then it's unlikely you're going to be able to interpret what it is that that study is saying. Similarly, if you can't put that study into one of these three groups, again, it's probably going to be very, very hard for you to interpret the results. As regards designing a study, as I said before, you need to have that clarity of understanding in order to design your study well. All right, so let's come back to your question, the one that you wrote down earlier. Now, I do know that many of you didn't write down a question, but that's okay. Pretend you did. Humour me for now. So the question you wrote down, or had half formed in your head, is it specific and focused? Is it clear? Is it answerable? Is it relevant or important? And what type of question is it? So I'm going to give you 20 seconds to have a look at your question and have a bit of a think about those features. All right, good. So moving on. So as I said before, the question type determines the study design. What do I mean by study design? And just going back to what I said before, so a research question, a research study is just a machine to answer a question in an unbiased way as possible. And what are the components? They're who you're going to collect the data from. They're what data you will collect. So the outcomes, the measures. They're when you're going to collect the data, so the timing of that. How you're going to analyze the data. And depending on the study you do, you may want to talk about which interventions are involved as well. And these all need to go into protocol before you start the study. The point here is that all of these points, all of these features of the study need to flow directly from your question. So it should be obvious from your question the answer to all these all of these issues. So you do yourself a favour in terms of designing your study if you have a clear question. So just as by way of example, and these are not obviously not all the study design features, and they're certainly not specific questions, but they're types of questions or subtypes of questions. So if you're doing a prevalence study, you need to do a population survey. If you're looking at risk, you need a longitudinal or case control study, diagnosis, prognosis, treatment effectiveness, experiences. The other thing the research question does for you is it tells you what sort of analysis you need to do. As I said before, that tends to be more simple than you think, but you only know that once you've got your question. All right, so just reiterating the point here that we need this research question to be really clear. The importance of that is that it's going to tell us how to do our study. So a few considerations. And I don't know whether any of you found this with those of you who had a crack at a question. Your first go at a question is probably too vague and too broad, and probably includes more than one question. Defining a question is a skill. It's like learning to juggle or brush your teeth or write left-handed or something. You need to practice it. The nice thing is you can practice that without actually doing a study. All right, and you can practice that by mapping it, coming up with a problem, coming up with a question, and mapping that against those important features. This is, I think, something which is quite nice for clinicians to understand and know about. It's that useful questions can often be answered with data that's already available or with simple surveys. And as I said, this is especially important for embedded research. It's the foundation of a lot of the research support work that I do at Nepean in the district. It's really about using information that's available clinically to answer some simple questions. And it may be, and it is at times the case, that those questions that are very simple in the first case go on to more more complicated, more complex, and ultimately more useful pieces of research, which sort of have a bigger impact. As I mentioned this in the last slide, data analysis is usually simpler than you think, but you're only going to know that once the question is clear. This is an important one. Don't do it on your own. And before you talk about your study, talk to people about your question. Talk to your colleagues. Ask them what they think about your question. And this is important to get to. This will help you make sure that your question is clear and focused, because people won't understand it if it's not. It will also help you get to a question which is very relevant and important. So ask people whether they think it matters what you're trying to do. All right, so just finishing up. As I mentioned, where my departure point is that research or QI is just about generating information, and it's relevant to a practice relevant question related to a practice. So the better the question is specified, the more robust the design, better the quality of the data, the stronger the analysis, and the more reliable the answer to the question. So all of this flows from having a question which is doing its job, and it needs to have those important features that I mentioned previously. So that's all I have. Should I stop sharing, Alex?
You can keep sharing for the moment, Steve. What I'm going to do is try
Okay.
to unmute people, so then we can try to take some live questions. And last time I did this, I stuffed it up completely. So just bear with me. All right, here we go. So hopefully that's given people the opportunity to unmute themselves. So what we might do is just open it up to questions. If you've got any questions, perhaps just put your hand up using the raise your hand function, and we'll get to you in the order that you've raised your hands. So while people are thinking about their questions, I will just quickly share some slides here.
Oh my. Sorry, I'll stop sharing.
That's okay. I might have.
Good. You've done it. Good.
I might have taken over.
That's good.
And so while people are thinking of their questions, I'll just advertise the rest of the RR-CLaN sessions for the year. We're going to move into our evidence-based practice seminar series. We ran our EVP seminar series here in Northern New South Wales. LHD last year was incredibly well subscribed, so we're opening it up more broadly. This will give you a bit of a sense of what we're doing. We're covering the 5 steps of EVP. So ask, acquire, appraise, apply, and assess. And this will be led by our wonderful research operations manager, Dr. Zoe Michael, here in Northern New South Wales. And we've got a hand up from Fiorina. So if you can unmute, okay.
That's correct.
Perfect.
Thank you. I find it hard when I'm asked to do a quality improvement, how to identify who my stakeholders are. Who are my stakeholders?
That's a great question, because I think it depends on your research question.
Mm-hmm.
And I think if you are able to define your research question really clearly, that's going to tell you who needs to be involved. So yeah, is there an example that you have in mind, or perhaps we could run through it?
Not at the moment, because
Okay.
I realized my question was too broad and wild. But yeah,
again, you know, I think part of the research question that you will need to define is who it is that to whom does what you're doing apply. So yeah, I guess if we can do that in a sufficiently clear way, then I think where you get to there is sort of a list of the people who are involved.
Right, thank you.
I think there is another question, but I can't see who it is. There's another 2.
I think I'm one of them. If the other person would like to go first, but I'm Mary Claire in Wagga.
Go ahead, Mary Claire.
Thank you. So yeah, very new to research. It is quite intimidating. I work as a clinical nurse consultant in Wagga, but in infection prevention. But I've put my research question there on the screen, and I think it is the 2 questions in one. Looking at doing study on how does isolation affect the mental health and overall well-being of adults. You know, when someone's in a single room and they have isolation precautions in a hospital setting.
Yeah.
And I wanted to specifically make it in relation to rural hospitals, but I think it's just, yeah, way too big, that question. It might not be the right time to ask it now.
Yeah, look, I mean, I guess if I'm having a look at that question, if we just leave out for 1 second what factors contribute to these effects, I'll just read out what he said. So how does isolation affect the mental health and overall well-being of adults undergoing isolation precautions in hospital settings, particularly in rural areas, and what factors contribute to these effects? So let's put the setting in hospitals, or a hospital in a rural setting, in a rural area. So you might choose to do this in one hospital, or you might choose to do this in several hospitals. As I said, let's just leave the and what factors contribute to these effects out for now. How does isolation affect mental health and overall well-being. So you've got your outcomes there. So mental health and overall well-being. So what you would need to do then is think about how you're going to measure those things. The bit which is problematic is how does it affect those things? So because what that implies is some comparison. So are you interested in a comparison of this same population of people? So people who, so what you haven't done there is defined who it is that you're interested in specifically, other than people who are isolated.
Okay. Yes. Yes, I was going to be adults 60 years and over, and I was wondering about having a comparison group. Patients that had visitors, patients that didn't have visitors.
Okay. So I mean, perhaps a question beforehand would be, does isolation of itself affect these things?
Yeah.
Okay. And so then you want to know that you're having a fair comparison between, so it's only the isolation which is different. You know what I mean? So you have to have a comparable group of people who are isolated and aren't isolated. And so that would be quite difficult. Might not be. But yeah, so I guess there's you know, I'd love to sit down with you and we could get to somewhere, but there's a little bit to do there, and it's just teasing out the important parts out, and it's often words like how, and contribute, which are others with bits which are not clear or not specific enough to get to the question. But there's I've never come across had a discussion with clinicians where we haven't got to something which is relevant and important, but it often just takes a little bit of teasing out. And as I said, things usually start too vague and a bit too broad.
Yeah, just going for a Nobel Peace Prize there. So thank you.
But you got to give it a few years.
Yeah. Thank you.
So I've got a couple more hands up, Steve. We've got Stacey Hall first and then Melanie Lang. So Stacey.
Hello, thank you. A great presentation, Steve. Thank you for that. I was wondering, so I'm looking at wanting to do a practice change or implement a practice change. So I guess it's more of a QI sort of focus in my hospital. And so I'm just wondering, so currently there's a strong evidence base for this practice change that I'm looking at, and other hospitals have done their own independent research on it and how that's impacted their own hospital. Yep. But that's something that I'm wanting to try here in my area. I'm finding it hard to go, well, should this even be, should we do it just because an evidence base exists? And it's supposedly, according to the evidence base, it's really good and it benefits patient care. But, and I see the way that they've gone about it is transferable to my own practice, but I just don't quite know how to, like, I feel like I've got a couple of competing agendas. One of them's to prove that it's worth doing. The second one is that quality improvement is research, which I'm really reassured to hear you say. And, I don't know. And then I go, what's your viewpoint on, if the evidence base is there and there's clear guidelines on it, not within our area, but within other areas, should it be something that we should be taking up? I guess I'm like, should I be doing some sort of scoping thing first about our hospital and our patient population, or?
Yeah, look, let me hit you with a few ideas based on that. My first thought is it's always an open question of how much evidence do you need to make a practice change, and so that's always going to be a job for whatever jurisdiction you work in. So that there isn't really an answer to is there enough evidence yet. That's a sort of consensus of people on the ground in that place.
Yeah, right. That makes sense. Yep.
So that as I said, that research evidence, we have an idea that it's because it's science, it's 100% bulletproof, and that's just not the way it works. Because evidence is inevitably indirect, it's the contexts are different. The things won't happen exactly the same way. The patient populations are a little bit different. Lots and lots of reasons. So you just have to make, at some point, you make a call as to whether the evidence is sufficiently strong to make that practice change. So that's the first consideration. Secondly, maybe there's a place for trying something. So that might involve a limited, applying something to a limited group and evaluating whether that has the impact that you think it does, you think it should. And on that basis, you can make a decision about further rollout. So that might be one way to go ahead.
Yep.
If the decision at some level is made to implement that practice change, you might want to reassure yourself that it has the impact that you expect it to. And so you might measure some outcomes before and after it to make sure that the change you've had has had the impact you hoped it would.
Yeah.
So that's another thing to think about. Another thing to think about is change is hard for people. All right. People like doing the same stuff over and over again, even if they say they don't. And getting people to do things differently is difficult. So there are often research questions, and this is a field of research that we call implementation research, and that's about not does a certain way of doing things work, but how do we go from doing things one way to doing things a different way?
Mm.
And so that's about how do we get people's behaviour to change from one thing to another. And so there can be a whole series of questions around that. And you can try things. You can look at, well, if we just give some people some information and tell them they need to change, will they change? Or if we go and give them a training package and we give them support and some feedback and we help them, will that make the change? Do we have to have a directive from executive that they have to change? So there's all, there's sort of all these different types of questions, but they all live in this sort of space of implementation research. So they're less about is something effective, because you've already decided that it will be, but it's how do you get that into practice?
Yeah, right.
So sometimes those sort of questions might be appropriate for whatever it is that you want to do.
Yeah, okay. So yeah, like a sort of like a little mini one before the full kahuna?
That can be one way to go about it.
Yep.
Or the other thing is you might go, or if it's going to happen anyway, you might just want to test that it's getting the impact you expected. Or as I said, this implementation idea. So what's the suite of strategies that we need to make something happen?
Awesome. Thank you so much.
Grace.
One more question or one more hand up, Stephen. This is Melanie. Melanie, go for it.
Okay. Can you hear me okay?
Yes.
Yep. Hi. Hello, my name is Melanie. I work within Southern New South Wales Health as a project officer for patient-reported measures. I've come to this space with a background. Actually, I'm a PhD student, so I've got a little bit of background literacy with research. I've actually identified some opportunities that I think are worthwhile exploring, and I've written down some research questions. So one of them was, and I'm not sure are you familiar with patient-reported measures or patient-reported outcomes? Yeah, excellent.
I think that might have even been in my PhD thesis title.
Lovely. So this might be something you're familiar with. I've just drafted a quick question, which is there a change in the patient-reported outcome measures between pre and post survey for patients within Southern New South Wales Health? So that's about identifying those changes, if there are changes over time. So I was thinking maybe like a point prevalence study or something like that. And it would definitely help improve or help us identify how patients are tracking over time.
Yep.
Just thought I'd get your thoughts.
Yeah, look, I mean, I guess some things that jump into my head is, are you looking at the same patients over time? So are you interested in what happens to the same group of people over a period of time, or are you interested in a group of people who get something at one point of time and another group of people who get something different at a later point in time, because obviously they're fundamentally different things. I guess another thing to think about, if it's the latter, and is how you're going to interpret that information. So let's say there is a change.
Yes.
Presumably what you want to do is have some speculation as to why that change occurred, right? And actually that's where the guts of your question is going to be, because that's what you're really interested in, right? Whether there's a difference or not by itself is not that interesting. But actually, I sense the question you're interested in is hidden somewhat in what happens between those two surveys.
Yes.
So that's where things are going to get more interesting, but also that's going to tell you what you need to do in terms of how you define your population, what you measure, and all those sorts of things as well.
Yeah, no, that's great. Excellent. All right. Yeah, they're broken down by cohort, and
Okay.
those cohorts have disease classifications within. So they have to be, so you have a group of patients, for example, who all have cardiac heart failure. They all have renal failure. They all have, and so they're all broken down into different cohorts. So that might make it easier in that identifying what's going on within those cohort, like what, because the programs they're in might only run for 8 to 10 weeks. And then new patients, the confusing part is new patients are constantly enrolled, and there's old patients who have finished over time. So that's the tricky part. So you've got start-stop times everywhere.
Yeah. So I guess this comes to whether you're interested in a longitudinal study of a group of patients, so measuring the same group of people at several points over time, or whether you're interested in two separate groups of people who are measured with some space and time in between, because those two designs will be relevant to very different types of questions. So this is sometimes where it's a little bit problematic. You don't want to start with a design or a data set, and then work out a question afterwards. You need to specify what is the question that you're interested in, and then ask, do I have the data to answer that question? And if the answer is no, then maybe you go to the next question. Okay, well, what about this question? But yeah, as I said, again, I'm just wondering, as we talk a little more, whether you're going, hey, I've got this fantastic, great big data set. Let's do some research. Whereas I think you need to really sit down and go, okay, what are the questions that I want to know? Is this about what happens to people over time? Or is this, are they benefiting from some service or whatever else? Or is it we've had some fundamental shift in the way things are done in South Coast LHD in 2021, and does that mean, and are people who came in 2020 having a different experience to the people in 2022? But again, this all starts with the question.
That's right. Yeah. Excellent. Thank you.
Thanks.
All right, one last quick question from Nerily.
I'm not sure if you sort of touched on it just with that last conversation, but I've sort of gained an interest in research. I'm doing a bit of a subject at uni this semester, and I know it kind of, you've got a deadline, so you don't really get to ponder everything for months on end. But what I noticed, the research question, it was like a rabbit hole, but I sort of got to a point where, undertook a bit of a scoping review to come up with, some more information, and then rounded out my question. But I was wondering if when you have your question, you've given it a couple of months, well, in my case, but I'm sure it takes 6 months or more, months to think about, and then you start to put together, I guess, the study design to come into it, do you then do you then ever find, or should it be an absolute no, that you might go, oh, gee, when I look at the design, I think I might have to reframe my question? Or
Yes.
do you
Yeah,
really,
and often on the basis of feasibility. So, for example, you know, the last conversation we had there, you know, you might have a wonderful available data set and think, gee, it'd be nice to answer this question. And so set up your question and go, okay, these are the data that I need to answer my question. And then go and look at the data and go, oh, hang on, it can't do the job.
yeah.
So I think the answer to your question is yes, that can happen. Or it might be, I come up with my question and then realize, well, actually, to really get the answer I want for this question, I need to do an RCT with 800 people in it. And I can't do that. Not without $2 million and, you know, 15 people. So often with regard to feasibility, you can't answer specifically the question that you first might come up with. And so then you basically you iterate and you go, well, what's a question that's going to get me a little bit closer to where I want to get to, and do things in that stepwise manner.
Because it sort of have felt that, like, once you do literature searches and trying to understand that I sort of was left with an idea that once I kind of went down the pathway of trying to develop a proposal or a design, that I was really locked into that. And I find that I keep having like I said, a new iteration around, you know, my thoughts around the question, because it's changed so much from where the idea hasn't changed, but the words and the framing and everything is completely different to when I started, but it's still the same issue that I want to address.
Yep, that's fine. That's and actually not unusual. And you know, so if I reflect on my experience as a researcher, sometimes we'll come up with a question, write a grant application, and it's not successful. And so we might go, okay, we're still interested in the same field. You know, I do stuff in pain in adolescents. The next year we might write a different, address a slightly different question with a new study, and hopefully that one gets funded. So absolutely, things don't happen for a variety of reasons, and sometimes they're due to feasibility, sometimes funding, sometimes you don't have the data available, whatever it is.
Thank you. I really enjoyed this session.
Cheers.
All right, folks, just conscious of time, we're going to draw this session to an end. I want to say a very big thank you to Steve for the very informative session. People can hang around if they've got any more questions, if you've got time, Steve, and we can answer them. I will draw the session to the end. Thank you, everyone, for attending. Please attend more upcoming sessions. Like I said, our next series of events will be the Evidence-Based Practice Seminar Series. If you've got a spare few minutes, please consider providing a little bit of feedback. We're using the same generic survey all year long. Other than that, we'll draw the session to a close. There's probably a question from, no, it was Jeffrey. All right, guys, enjoy the rest of your day. Thank you for attending. Again, thank you, Steve, and we'll see you next time.
Yes, thanks all.